Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. Surviving clinical year.
Yeah.
I wanted to do this one for a while. I feel like this is a good timing because clinic year starts like soon, right?
Yeah.
Like it's the rollover is typically January.
Yeah. For certain programs,
Yeah.
you'll do an entire year of clinic rotations starting in January.
Mhm.
So as
Yeah,
we are
so-
all losing our minds academically in December, we get to look forward to what I would consider like the fun time. Like, not that academics is not fun, but putting on the jacket and seeing the patients, like that's where you'll figure out what you can and can't do.
Yeah.
What you're really made of.
And we have a
Yeah.
guest with us today, Jordan.
Yeah.
Jordan rotated with us, a year ago?
Yeah.
now?
It was this time last year.
Yeah. And
my last
now
one.
That's right.
you just started your first job.
I did just start my first job.
How is it?
It's good.
Yeah.
It's crazy being out in the workforce and being like, oh, everything I've learned is actually happening.
Yeah.
But it's been good.
Putting it all to test.
We'll Jordan, start first and tell us what your school layout was. Like
Yeah.
what the timing of when you started, how long your academics were, what rotations you did, and kind of, start there.
Yeah. So my school was a 2-year program. So we had 1 full year of didactic that was January to December. Then we had a little break. And then our clinicals were January to December for the second year. I had 6 core rotations that were all 6 weeks long.
Mhm.
So that was family med, ER, peds, surgery, internal medicine. And then we had a split behavioral health, women's health. So that was technically 6 weeks, but it was 3 and 3. And then we had a 6-week elective. And that's when I did ortho.
Yes.
So my first rotation was actually family medicine, which
Okay.
was very interesting to kind of jump into.
Yeah.
And
But it's a good one for
it is a good
first.
one. And I
Yeah.
think for those that are either considering PA school or currently in the throes of it, PA school, didactically will take you through, at least mine did, clinical rotations. So you learn about internal med, family med, endocrinology, ER. You learn about all these things like in a book, on paper. You do clinical cases that should have some relevance to the real world, and it sets you up for what you think you'll see. And then you do rotations, and they either are or they aren't that.
Yeah.
So I guess take us through your family med side.
Yeah. So my family med, it was very interesting to have that first because it was kind of one of those things where I was like, I have no idea what I'm doing.
Well, what were your expectations?
I guess I just wanted to see as much as possible.
Yeah.
And the practice that I was at, it was kind of a different practice. They had a very interesting patient population. It was a lot of basically just, even though it's family med, it was all older adults, a lot of mental health, and a lot of hormone therapy.
Okay.
So it was a very interesting patient population. So it was just a lot of things that I hadn't really seen before. And I remember we had one lecture on hormones therapy and things like that, but actually seeing it in practice was really different.
Were you in a city, rural, suburban? Where was the population?
College town, kind of.
Yeah. So well educated.
City, yeah. Mhm. Everyone basically knows what they have when they come in, and it's
Mhm.
very much just seeing oh, was Dr. Google right?
Yeah. How were you received by the patients that you saw? When your preceptor would introduce you or not? What did that patient population do with you? Were they accepting because it was a college town, or were they kind of no, I'll just wait for the doctor?
They were pretty accepting for the most part. I mean, there was a couple of patients that were kind of I'd rather just see them. But I'd say for the most part, they were all pretty accepting and really nice. And all of the support staff and everything at this office was awesome. So I think I really had a great clinical year experience on all of my rotations.
And you were just chronologically, this was post-COVID, right?
Yes.
Okay.
Mhm.
All right. So there was no restrictions with where you could go, what you could do.
No.
Cool. Did you find yourself doing physical exam, history, procedures, or were you more doing note taking?
Yeah. So it was kind of a mix of both. I think it mostly started with, I would just kind of watch my preceptor for a day or two. And then it was more me going in and taking a history. And then I would do a physical. And then I think because mine were so long, like my 6 weeks rotations, by like week 3, week 4, I was doing the notes.
Yeah.
And then by week 5, week 6, I was basically doing the whole visit by myself.
Yeah.
And then my preceptor would just kind of like look over the note and add her stuff into it and whatever. But at that point, she was just kind of like checking over me, which was nice.
It's crazy that like, because Jordan and I went to the same PA school, so we had the same like time frame for these clinicals. By the 6 weeks, you start to feel like comfortable and like just comfortable enough that you can do certain things by yourself, and you kind of don't want to leave. You're like, wait, I like this.
Yeah.
Like,
and then they pull the rug out from under you, and you're in like a completely different spot. And,
Did you rotate with a physician or with a PA?
My family med was a PA.
Okay. Same.
And she was awesome. I love her.
Yeah.
And I think that was really different. I didn't really see like her supervising MD a lot.
Yeah.
Like they were there, but I didn't talk to them.
So that's a real realistic picture of kind of probably how it goes in family medicine, where you're really the primary caretaker for your patients, and there's not a lot of collaboration with the doc, but there is oversight, either like closely or not very closely.
Yeah,
I think that's very real.
Ability to ask when you need, but like mine was this. Like I definitely never met any of the docs that were overseeing my family med PA that I
did. You do family med in a private practice too, Hannah?
No, it was like us off of the hospital system. I think.
Okay.
It was in a really rural area.
Okay.
In Sanford.
I did mine in Yonkers, New York. So it was like in the city, and my supervising physician, it was a private practice. So he owned it. His wife was like the front desk person. Like it was, very much family thing. And he was a Israeli guy that had a lot of patients that spoke Spanish. So a lot of these visits were conducted where he was fluent in Spanish, but it had like this Israeli like accent.
That's
I would
crazy.
sit there and I'd be like, what's
happening?
Really
but his patient population, it was like, again, for me, it was like 20 years ago. But the highlights that I remember is diabetes, hypertension, pull out your med list. Let's see what you have. What do I need to refill? Like it's so much of that. Plus like a ton of rectal exams. I mean, that's just what I remember.
Really?
Yeah.
You did a ton of rectal exams?
I didn't, but he did. And I remember like, again, the family medicine, it was a lot of older patients who had been seeing this guy for like 20 years. So he was kind of their go-to for a lot of things. But when he needed to refer out to a specialist, he did. But I think my vision of what it should have been and what it was, it reminded me of like old school, like you have a doc that you're seeing for everything. Like, hey, can you look at this mole? Like, hey, can you look at my knee? Hey, can you look at my shoulder? And also, can you unclog my ear?
Yeah.
But yeah, he let me go in and see patients and then, report to him. And then by the end of that same thing, I was doing that all on my own. It's kind of sad to leave, but
I really liked mine. That was probably my second favorite rotation.
Is it story time?
Yeah. It's always story time.
Okay, so his name is Dr. Anabi. I remember that just because, I don't know, I just remember that. Anyway, so procedure-wise in family med, there's not a lot that they do, but I remember he was like, hey, do you want to take off some skin tags? And I was like, okay, like, where's the patient? And he was like, well, I'm the patient. And I was like, okay, great. So like in the ortho world, we wear scrubs, right? He wore like a button down every day.
Yeah.
So, go in the exam room and he was like, like a portly dude. So he like, takes his shirt off. This is literally my life, right? Takes his shirt off and literally does like one of these.
Like on his armpit?
So they're like a complete like small population of skin tags in his armpit. So anyway,
like a community of skin tags.
It was a community. It was a small town. So I was like, okay, so like all of them?
Yeah.
Like, how long are we going to be here? And he's like, yeah, I mean, if you want, so he had like the little silver.
The shave biopsy thing.
Yeah. So anyway, so I just like start going to town and then cauterize, go to town, cauterize, go to town, cauterize. And he was like, that was really great. Like I felt nothing. And I felt like on top of the world. I was like, that was really cool. Super awkward. Not really sure that was appropriate. When he started taking his shirt off, what is happening here? I don't know. But anyway, so like as the day went on, okay, he's got his white shirt on and then he's got his jacket. Oh. And he's like, examining patients, whatever. And there is a field of blood in his armpit. And I'm just looking at this like, oh my God. Yeah.
Okay.
That was family med
Did you
for
like
me.
were you like, hey, by the way?
Yeah. And of course, because his wife was like the office manager / front desk, she had like 8 more shirts in the back for him.
Oh,
And he just very casually was like, oh, we probably just need to cauterize more. And I was kind of like, yeah, but we did 67. So maybe that's also why.
Yeah, could be.
Probably the friction of going back to life.
Oh my gosh. That's fun.
It was family medicine. Yeah. But I think like what I learned, besides how to take skin tags off in, suboptimally, I don't know, was like the meds. Like that was the first, I think, application of your pharmacology that you learned, where pharmacology, you'll learn generics and then you'll learn brand names, and in real life, in real practice, like it's both, right?
Yeah.
And that was at the time we were actually writing on a script pad, and it would just be like writing here, writing here, writing here.
Oh, wow.
Yeah. That was cool.
Yeah. That you learn your basics in that rotation.
Yeah.
It's a good first one to have for sure.
Yeah.
It's just like absorb as much as you can. And I think the rural rotations are really good because like I had a little ortho.
Yeah.
I had a little, basic family med stuff, and then I would have a little bit of everything else too. So,
but I also feel like that's why a lot of PAs go into family med, because you do feel confident after 6 weeks.
Yeah.
That's not necessarily true for the rest of the rotations, but I feel like that's a good field to start in.
Yeah.
So my first rotation was internal medicine. Mine was in a hospital setting.
Mine was hospital.
Like telemetry floor patients, looking at their labs, a lot of rounding.
ED admits.
Yeah, it wasn't really like labor intensive. I feel like you don't do a lot because these patients aren't going anywhere.
Yeah. And you're seeing I saw 4 a day.
Yeah, the volume is not crazy. Family med, the volume I would say was like 20 something a day.
Yeah.
So you're busy, right?
Yeah.
But internal med is just a totally different pace, a totally different lifestyle.
Charting mostly.
Mostly.
I got real comfortable with Epic.
Yeah.
Did what was everybody's schedule with that? Was it 12s, or Jordan, did you have?
Yeah. So mine, it was a 6-week rotation, but I worked 7 days on, 7 days off. So it was really like 3 weeks.
Wait, did we have the same one?
Mine was in
Charlotte?
Charlotte. Yeah.
Oh my gosh, we did.
Yeah.
Set like 7/12s?
7/12. So it was 7 to 7, 7 days in a row. And then I was off for a week.
It was awful.
Yeah. No, I did not like my internal med rotation.
Crazy.
That was probably my least favorite. I loved my preceptor. She was great for the most part. But that was the one that made me be like, I'm an outpatient girly. I do not want to be in a hospital. Yeah. Get me out.
Yeah.
It was 2 hours away from where I live. So I actually lived with my soon to be in-laws for a couple weeks.
Yeah.
Because that was like my away rotation.
Yeah.
But yeah, it was 7/12s in a row. And then I was off for a week. And it was during the summer, which was nice.
That is nice.
Because then I could go to the beach and do things, or study on those weeks off, because I was not getting anything done. Well, I could kind of study during the day, but not really.
Yeah. Mine was hospital too, and it was 12-hour shifts. But I remember that was PAs. So my family med supervisor was an MD. There was no PA there, and then this was all PAs. But I remember them telling me that their hospital schedule was 3 months of the same 3 days, right? So someone would get Sunday, Monday, Tuesday, and they would work that for 3 months. Then the next time they would get Monday, Tuesday, Wednesday, and then it would kind of shift like that. So that was a good intro into what shift work was. But I didn't love it.
Yeah. I mean, I think for me, that being a first rotation was, again, a good broad overview of certain things. I'm doing a lot of med recs and stuff. I'm just looking at the names of meds and orienting my brain around how to put in orders and do very basic things. But fun fact, I really hate sick people. I don't like germs and illnesses. So internal medicine for me was just I was anxious the entire time.
Yeah.
Especially
sick.
People that you have precautions when you go in the room, it's contact isolation, or this one has C. diff, and you're like,
I learned so much about PPE and the different things. And it was my first day of my internal med rotation, my preceptor gave me 3 room numbers and was like, okay.
These are yours. Yeah.
And I walked away and she disappeared for 8 hours.
Yeah.
And I was just like, what am I doing? What? And I was like, I don't know what respiratory, what, and they had the little signs of what you had to put on. And I was like, oh,
this
was not what I was expecting.
Yeah.
And I was in a med surge floor. So it wasn't even anything super, it wasn't ICU. It wasn't anything super critical. But I was just oh,
I remember there's a lot of patients who were like pneumonia patients or had diverticulitis and were admitted for that. But everyone was on telemetry.
Yeah.
One of the PA jobs was to do the blood draw when we didn't want to wait for the phlebotomist. So I got really good at doing blood draws on like real patients. Yeah.
That's one thing I never got to do on rotations was like
IV
blood draws because they always
had
would
phlebotomists.
Yeah. Or like they would have to go get like an IV or ultrasound guided
team. Yeah.
But yeah, it was a lot of sick patients.
Yeah.
Did you get sick during your rotation, Hannah?
I'm certain that I did. Like probably honestly from not the hospital. It was probably just like my own anxiety killing my immune system, and I got it from somewhere else.
Yeah.
But this was it was just pre-COVID. Yeah. So I started internal medicine 2020 of like January of 2020.
You probably saw a lot of patients who had COVID.
Like
you just
the
didn't
first
know what
COVID
it was.
people. Yeah. So ironically, the last week of my my internal medicine rotation, one of the internists there was coming back on a trip from China, and they like wouldn't let them come back to work.
Yeah, I
so like
believe that.
stuff started happening as I didn't know about the things yet.
Yeah.
Then went on to my surgery rotation where shit hit the fan from a COVID perspective. So, but yeah, I think for internal medicine, it's a lot of charting. You get good at charting. I think if you learn how to use Epic, you'll be comfy.
Yeah. No kidding. I think PAs will learn like your normal electrolyte numbers, and then that helps you for test taking fluid, like when someone gets normal saline, when someone gets lactated ringer, what rate you're supposed to infuse it. Like I remember that was very helpful.
Do you remember any of that now?
I just remember one PA who was terrible, and all she did, I thought, for the entire 4 weeks that I was in internal med, is she just checked people's magnesium. And I'm like, why is she doing that? Like, I learned a little bit about that and why that's important. But she also would help us. It's not help, but when patients would pass away, you'd have to do a confirmatory EKG. So I did a lot of those on dead people.
Interesting.
Oh, yeah. Never did that.
Yeah.
Because, which is stupid because like you place the leads and then turn it on and it's a complete flat line. So am I doing it right? I don't know.
No, who knows?
You know what I'm saying?
What if you just did it wrong and they were alive, Beth?
I don't know. I mean, I thought about that for some time, but yeah, she had us do that a lot, which again, turns out she probably wasn't the best PA. But yeah, I never saw a supervising physician.
Yeah.
I know they were there, but I never saw them just because it was more, maybe it was early morning rounding or something. I don't know. But
mine was a supervising MD, and then she had a PA that worked the same shift as her. And then I guess the night shift person came in like 2 hours before we were supposed to leave.
Yeah.
So the PA did mostly at the admits from the ED. So I only ended up doing like 1 or 2 of those on my rotation. And he was actually switching jobs.
Yeah.
Because he was moving to a different hospital. So he was kind of in that phase of like,
checking
I'm
out.
leaving.
Yeah. I'm done.
And then speaking of COVID and like getting sick, so all of my rotations were after COVID, but my preceptor, I started my rotation like that first week of my rotation, it was off because she wasn't working. She came back from a trip from like Poland or something and got COVID. So then my whole like first rotation on week, I was off for like half of it because she couldn't come to work. And then crazy. I definitely think I got sick from that because I remember being at like my in-laws' house and I slept for like 14 hours.
Yeah.
And I was just like,
that's
what?
Normal.
Yeah, that's crazy.
Oh God.
So let's get to the fun ones. So surgery and ER.
Yeah. I'll say surgery. My surgery rotation for me wasn't fun because I only like orthopedic surgery.
Oh,
and this is general surgery.
Yeah. It was a lot of general. My surgery was my first rotation. That's not true. Sorry. ER was my first. Surgery was my second, which is generally not how that goes, but just the way that we got assigned. So again, going a little bit backwards, in ER, I did a lot of what I would think are primary care things. And then I went right into surgery. So I had already done laceration repairs before we did the surgery stuff. But my surgery rotation was at Montefiore in New York. And it was a teaching hospital for MD students, but also they had a PA residency at the time. So there was like a ton of degrees of people there. So it was PA students, PA residents, PAs that work there, MDs, MD students, fellows. It was like a ton of... There's a ton of people.
Yeah. That's does that take away from your experience at all? Did you think?
Again, nothing to compare it to, right?
Yeah.
But the hospitals that we work in now, the ORs, there's a ton of them. But I remember the OR, there was like 60 ORs. So there was never, it was insane. Like you could, if you really wanted to, just hang out in the OR and then just scrub into whatever you wanted.
Oh,
So they assigned us
nice.
4 weeks
That's
general, which was colon. And
Yeah.
then it was 2 weeks ped surge and then 2 weeks like whatever you wanted. So I ended up doing ortho.
Oh, that's cool. You get a little variety.
Yeah.
Yeah.
Jordan and I had the same preceptor for
Okay.
Oh, yeah,
surgery.
we did.
Yeah.
We saw, I don't know if he was doing it when you had him, but he did like all robotic surgeries
Okay.
pretty much.
Yeah, we didn't do any robotics at the time.
So for me, it was a lot of watching a screen.
Yeah.
But like we did other stuff too. Like if there was ever a colon one, that was pretty much like open.
Yeah.
Mhm.
And he did a lot of like cysts
Yeah.
removals and stuff. But a lot of like the gallbladders and
Yes,
the
ton of
appendicitis and all of
gallbladders,
that was
Mhm.
robotic. So it was a lot of just
So let's
there.
talk about the hours for your surgery.
yeah.
set.
Uh-huh.
So
God.
I at the time was living in the Bronx, so like I had to take public transportation to get to the hospital. So I would wake up at like 3, get on the train. I'd have to get in at like 4:30 to
Mhm.
pre-round
Pre-rounding,
so
yeah.
that the
Yeah.
rounding was, all the wounds were like exposed so that was ready at 5 and they were done around 6 and then OR at 7. Like that was the first part of the day. But I remember ulcers, ostomy bags and just
Drains
oh my
and-
God,
yeah.
a ton of drains, ton of smells like
It's
that.
just-
But it was long. And then around 3:00, maybe 4:00, maybe we were done in the OR. Then it was post rounds, like at the end of the day.
Mhm.
And I gained a lot of respect for like senior residents and chief residents because they do so much.
Yeah.
So much.
Yeah.
But yeah, talking about sick patients, man. A lot of sick patients.
A lot of sick patients, but like I enjoy being in the OR now. I did not enjoy it then
Yeah.
because of the type of things, one, that we were doing. And I think too, just like until you get comfortable in that setting, it's very uncomfortable
Oh,
to
yeah.
be
Yeah.
in it.
Yeah.
And hours wise, I don't know if we had the same experience, but like I feel like I was there all the freaking time.
Yeah, all the time.
Like
Yeah.
I would get there at 5:30,
45 in
5:45
the morning. Yeah.
pre-round. And then we would constantly get bumped for
Yep.
stuff. And I remember specifically one day, and this is not the only day that was similar to this, we had like a reanastomosis case and it was supposed to start at 3 and then it didn't start at 3 and then we kept getting bumped for something. And I think it started at 7:00 at night.
Yeah.
And in my mind, I'm like, I've seen these before. Surely he's going to be like, punt this one, like go home.
Yeah.
Oh no.
No, that was never offered or suggested to me, so I didn't. And I think we were in there until like 2:30 in the
Yeah.
morning, and I was like, I guess I'm not going to go home tonight. I guess
Yeah.
I'll just like sit in my car for an
Yeah.
hour and like
Like-
maybe try to nap and
Yeah.
then get
Yeah.
up and do it again.
Yeah.
Insane.
Yeah.
And the worst part is, like, I felt like I wasn't even that helpful at this point in my
No,
life. Like I wasn't doing anything to
Yeah.
matter if I was there or not. So that's
Yeah.
why I hated it.
So that brings up a really important point. So I did a surgery rotation with one of the PAs who I cannot believe she's a PA. Like just even during the didactic year, the things she would say, I'm just like, oh my God, this girl, you're not in the right field. I'm just telling you right now. And she would just like hide all day.
Yeah.
I don't think she did anything, but it just, again, bothers me to my core that she graduated PA.
Yeah.
She said she did the same surgery
Yeah, you're the
rotation I
same
did. I was like,
people.
what?
Yeah.
You're not the same people, Hannah.
My surgery rotation made me never want to have to need a surgery.
I know.
Ever.
Yeah.
Just like the things that go on
Yeah.
and like even just like the people like the surge techs and like there's just so much that has to be done a certain way.
Yeah.
And like as a student, you're like obviously the lowest on the totem pole. Like
Yeah.
no one cares
Right.
about you. They're like, what are you doing? Don't touch anything. Like
yeah.
whatever. And then it's like time to scrub in and they're like, where are you? Like, come on.
I know.
And
I
it's
know.
like, well, you like, I don't know what's going on.
Yeah.
I don't know
Yeah.
how long
Yeah.
I
these
feel like
take.
in order to survive surgery rotation, you have to develop a thick skin because you're blamed for a lot.
Yep.
People yell at you. You're never there when you need to be. And also you're always there too much. You're
Mhm.
never helping enough,
Yeah.
but you should jump in when
Be more helpful.
be more helpful. Yeah. I mean, I feel like that's a very, it was a very useful rotation.
Yeah.
Yeah.
It makes me never want to do general surgery. And why would anyone for that matter?
I don't know. Like I did, the general surgeon we were with, he did give me a piece of advice. He was like, because I was always honest with my preceptors when they were like, what do you want to go into? I was like,
Yeah.
orthopedic surgery, not this.
Yeah.
He's like, well, this is like, if you want to do surgery in any capacity, like
This is helpful.
this is going to be helpful, not just from the being in the OR perspective, but like the timing perspective. Like you aren't going to have a life basically. And he was right. Just kidding.
Yeah.
I do have a life.
Yeah, but
That sounded dramatic.
But I
Yeah.
know. No, I think general surgeons have less of a life.
Yeah.
though.
Yeah.
Unless you get to the point where you're,
It's like a
where you
flex
got
for
enough
them.
people under you, right?
They like
Yeah,
being miserable.
Yeah.
I think, and I would hear them like in the halls comparing how little they would sleep.
Do you know any PA that went into general surgery?
Yes.
Do you really?
Mhm.
I
think
do
it was
not.
Were
I do
they
not.
in
From
your class?
the class above me,
Class above you.
they had it was like a new role they basically created for him, and it was actually a pretty decent job. He would just round and then like take admits from the ED and like do the
So he's,
pre-op
like,
workup.
Yeah,
so he's a
my-
He
floor
would
PA.
scrub in sometimes.
Yeah. Yeah, I thought it was interesting because on my surgery rotation, I thought maybe I was like, oh, like I like the surgery aspect. I didn't like OR
Yeah.
that much. I know when I came to this rotation, I was like, I hate being in the OR.
Yeah.
And you were like, well, you're going in the OR. So,
Yeah.
Get uncomfortable.
but it was kind of like, oh, like we don't, like I don't really know why what I don't ever want a PA
Yeah.
on my team. And I think it's funny because one of my classmates is now his PA
Yeah.
for
Oh, man.
him and his partner that it's like the same
That's
clinic.
so
that they
But it's
work for.
probably that preconceived notation, especially the PA girl that I went to school with, is because you get one of them and you're like, I'm never having that PA.
Yeah.
You're never having a PA because all PAs are terrible.
Yeah.
Yeah. That was the first time I was on call too, was my surgery rotation.
Yes.
So that was like anxiety inducing in and of itself
Yeah.
because I was like, is my ringer on? What if I get called in? Blah, 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 blah.
Yeah.
Did you sleep?
I did, but like I did get woken up at 3:00 in the morning.
Yeah.
And was like, oh, you have to come for this appendectomy
Yeah.
right now.
Yeah.
Robotic appendectomy.
Yeah. I think like, mindful living, like, eating correctly and working out goes out the window.
Oh, yeah.
You
Out
can't.
the
No,
window. You
It's
cannot.
impossible.
And then you eat hospital food, which ended up being okay.
Yeah.
And then learn to like shoe wear is important.
Yes.
Yeah.
Like what you're standing in all day
Yeah.
really matters.
Compression socks
Compression
became my
socks,
best
yeah.
friend.
Yeah. I learned to suture tie quite a bit. So we had at Montefiore, they actually had like a learning lab, and it
Oh,
was
cool.
all, wait for it, it was all dogs.
Dogs.
Yes. Like it was all like, the dog was like covered or whatever, and you would have exposed whatever part you were
Mhm.
doing. So you would do like a vein anastomosis or something, but you'd see like the fur.
Oh my god.
I would
But
leave.
you, but you, I mean, I'd be
Like
guys-
you have
are guys
to, you
okay?
have to go. Yeah.
No, you don't have to go, but like you could go there. So let's say there was nothing else going on, then you could make the most of your time and go do that. I mean, it was really cool to just get your hands in,
Yeah.
and do that. That was like,
No, that's helpful.
yeah, that
Yeah.
was it was an amazing experience, but also like
Poor pups.
I won't unsee that.
Yeah.
Yeah,
I thankfully did not have anything like that.
yeah.
But did you have any crazy OR experiences? Did you see anything wild? I know you did.
Yeah, I did.
Yeah.
I'll tell that one now.
Yeah.
So it was actually a different rotation. It wasn't my surgery rotation, but it was in the OR and it was a surgery. And it was a laparoscopic surgery actually. And my preceptor was first assisting on it. So that's why like I was there. And the main surgeon on it is like this big shot surgeon, really important, like did not even like I was asking my preceptor if I needed to do anything. And he was like, oh, he's not even going to know you're in the room. And I was like, okay, cool.
Perfect.
Sounds great.
Right,
Awesome. Please don't talk to me. And basically when you were doing the laparoscopic and he was suturing something and the suture needle on the laparoscopic piece like broke inside the patient.
Which is not uncommon.
Not uncommon.
Not uncommon. Yeah.
But like there's things in place to take care of it and you try to figure it out. And the charge nurse or the nurse that was in the surgery was like stopping everything, calling up the x-ray team to find it. And this man was like, why are we wasting so much time on this? Like, it's not going to come out. It's not going to hurt them. This is just like, what are you doing? And he got so mad. Him and the nurse started going at it. And I'm just sitting there and I'm like staring at my preceptor because it's not even the man who's doing the surgery.
Yeah.
Like, we're just there.
Yeah.
And I'm just like,
it's horrible.
hey.
Yeah.
Just on the corner.
But even like ethically,
Really?
like you're just in the totem pole of where you are important wise in the room.
Yeah.
Like you're allowed to have opinions, but you're not allowed to say.
Yeah.
Yeah,
You can think your
exactly.
opinions.
Yeah, you can think your
so.
opinions. Yeah.
Yeah.
That's that is also something that you don't learn in PA school until you're
No.
like in a situation
Mhm.
like that.
Mhm.
I have this is not really we'll save that for another time. Got another story. Anyway,
Okay. ER. I liked ER.
I
That's
loved
fun.
ER.
Yeah.
I wanted to work in ER.
Sorry.
I wanted to work in the ER so bad because I did like they had the ER, which is a main ER, and then they had what was urgent care ER. So a PA
Like a fast
okay.
track kind of.
fast track.
Yeah.
That's it. So PA worked the urgent care part of it, and then PAs were on the other side. But it was like if there was something traumatic going on, and usually it was cardiac, you're over there. And if not, it's a laceration, reduction. Like, it was all procedures.
Yeah.
I was like, this is amazing. I actually met the doc that I first got a job with through the ER.
That's awesome.
As he was doing like ortho consults and stuff like that. But I love the ER.
Yeah, I loved my ER rotation.
Yeah.
I feel like at least my experience was kind of similar to yours.
Yeah.
Again, yours was during COVID. Right?
Yeah, so that we had a lot of restrictions on ours. It sounds like you got to do a lot more without those restrictions.
Yeah.
So
the ER I was in, it was like broken into pods, and it was like pod A, pod B, and then C and D were like where all the PAs went.
Yeah.
And it was all like the lac repairs.
Yeah.
I'm coming in and I think I have bronchitis, or like the stuff that shouldn't really be in the ER.
yeah.
And then the A and B side was like all MDs, and it was like the code strokes and all that kind of stuff. But I had a different preceptor every day for that rotation.
Cool.
So I got to see a little bit of everything. And I did all of the like higher acuity level stuff, like the level 1s and level 2s, before I was in like the 3 and 4 PA area. So I loved my ER rotation. It was very hands-on. Yeah. My biggest piece of advice for that one is just like, don't be afraid to get out of your comfort zone and just do it. Yeah. My first day of my ER rotation, they called like a code blue, and I guess whatever pod of the ER I was in, they went to like assist on that. So it was like this guy getting a vascular surgery that needed chest compressions. And I was like, oh, I've never done those on like a human before. And my preceptor like threw me in the line and was like, okay, find me when you're done. And just like left me in this room. Yeah. And I did chest compressions on this man. Don't even know his name. Yeah. Like, it was wild.
Yeah. What I love, again, same thing. It was really procedure heavy, but I didn't love the fact that you never know what happened to the patients. Yeah. Like, you send them out and you're like, you know, did the incision, like, did the laceration look okay?
Yeah.
Did it get infected? Yeah. Did you need to have like more work done? Like,
did you come back a week later being like, PA student that I saw?
But but it's even true now, which I didn't know until I got into like ER, is when they come in, you're in a hospital, right? So obviously if something needs to happen immediately, you can order whatever tests and get them done. But like the x-ray stuff, the x-rays get ordered and then you look at them. There's no radiologist reviewing your x-rays until like the next day or whatever. And I thought that was terrifying, which is ironic because we do that every day now. But I did not think that was a thing, you know, in didactic here versus reality. But you have all these. It is. And then now, like working on the orthopedic side, where we see these x-rays and then you'll see the reads of them and you're like, they're wrong.
Yeah.
Like, it's crazy.
I know. Yeah. I actually, when that happens, I kind of like it.
Excited
a little excited. I'm like,
do you have any good ER stories?
The chest compressions one was a big one. And then there was one, it was kind of a slower day for the ER. Honestly, like mine had a lot of borders in it, so they didn't have like a ton of beds in the ER. So it was like very interesting. And I remember this one lady came in with like EMS, and I went in and like did the assessment, whatever. I was like, oh, I think she might have like an intracranial bleed or something. So we did all the testing for that, and she did. And I remember me and my preceptor, we were actually talking about Taylor Swift and how his kids were Swifties. And then one of the nurses was like, oh, like her breathing rate's getting kind of high. Like, do you want to intubate? And he was like, okay, I guess. And like, you know, they have the whole like team that comes in and does it. But I remember walking in and he's like, are you a righty or a lefty? And I was like, a righty. And he was like, okay, cool. Like, it'll be easy to walk you through this then. And I was like, what? Yeah. And he just like was like, okay, this is what you do. And so he just like let me, like, didn't even make a big deal out of it. It was just like, okay, you're going to intubate her. And like, I did the intubation and whatever.
That's awesome.
And then they had it where like we were there while in the middle of a switch shift. So like your preceptor switched in the middle of the shift too. And then later that day we had EMS bring in, it was like a teenager, I think, who was in status epilepticus, and they just couldn't get them out of it. And we ended up having to intubate them as well. So then I intubated twice in the same day. Oh, wow. And I remember I like walked out of the second intubation and my first preceptor was still there. I guess he'd finished his notes and was like waiting to see what happened. And he was like, did you just intubate a second person today? And I was like, yeah. And he just like put his fist out like for a fist bump. But then he just like walked out of the hospital. And I was like,
on top of the world.
Amazing.
Yeah. You were like, oh.
Yeah, no, I would feel amazing.
Love that.
I was like, I loved my ER rotation. I love the ER.
Yeah, it was really fun. Do you think, again, this is random, do you think your rotation now, right? So the perspective you have, you've gone through it. now like all these like TV shows and stuff. Like, do you ever get annoyed and pick out like that's not real?
Yeah,
or, like that is actually real.
Yeah, a little bit. It's funny because me and my husband just recently watched like The Pit.
Yeah.
And I liked that one.
Yeah, I watched that one
and
too.
I thought like maybe what they were doing like showing wise wasn't super accurate, but like a lot of the things they said I feel like were pretty accurate.
Yeah.
And I remember being like, oh yeah, or like something would happen and then my husband look at me and be like, did you do that? And I'm like, yeah,
no big deal.
Yeah, no big deal.
Nothing like super like nothing as intense as The Pit, but that's like the only real like medical show I've watched.
Yeah,
because like I can't watch anything else because I just get annoyed.
Yeah, no, I agree with you. It's funny you said that because I agree with this assessment of that too. I think The Pit was very like, especially with like understaff and yeah. And when things like emotional happen, like someone comes in and they die, you're just like, all right, who's
next?
Yeah, it was just
crazy.
Yeah,
I did a lac repair. Well, we did a lot of lac repairs in the ED, and I remember like they would set this stuff up for you because like I don't know, they would just like have it all ready to go.
Yeah,
right. You go in and do it. So I used all the equipment, the lac repair tray, and whatever sutures they had pulled for me. They're like, okay, just go in the room and do it and come back when you're done. So I sutured this guy's face, and it was like into his beard area, and he had black beard hairs, and they gave me black nylon sutures. I am just but a little PA student at this point. I didn't even know different colored sutures exist. Okay.
Right. Yeah.
So they did come back to the fast track side for suture removals. They would come back like a week later, the same patients. And I just happened to be working the same day that he came back, and whoever saw this guy like hours before I came in to take them out came and found me and was like, why would you have put black nylon sutures like where his beard is, because it looks the same as his beard hair? I was like, I don't know, that was the one that they gave me. Like, what do you mean there's other colored sutures? And that was a learning moment for me.
I think that's terrifying, especially when you see that as a provider now. You're like, why would they do that? Cut it so short, and why would they make it black?
Oh my God.
My preceptors on my ER rotation were just like totally different than any of the other preceptors I had. They were like, I don't want to say more chill,
but it's a different personality that survives in the ER. And you probably it's very just like kind of blunt. Like no multitask, very smart people,
like can move on from one thing to another, and it's just like, oh, can you go tell this person that blah blah blah, and then it's like, oh, but that one needs this. And on my first day, I'll never forget the first preceptor I had. He told me, and I think this was a big piece of advice that I took through my whole rotation, but it was like, the ER is a completely different mindset because you don't have to figure out what's going on. You just have to make sure that they're not dying. And it's like, you do your test, you rule out what you have to rule out, and you send them on their way. Like, you don't have to sit here and manage their chronic kidney condition unless it's like, oh, they need dialysis or they're going to die.
And it's funny you say that, because when we see, like, let's say we saw you as a student in ortho, like, you have to switch your brain, because in ortho, I don't care necessarily what their history was with, diabetes and how they're going through this and this. Like, I just want to pinpoint history. Give me the things that'll affect what I'm doing today. But if you're coming from family medicine, you want to tell me everything they've had over the past 20 years and why that's relevant to their pinky, But with the ER too, you just have to switch, like, turn it off and pinpoint what you're doing.
And I really liked that. And I've noticed that that's the kind of that I like. And it's interesting because now I'm in family medicine, and it's like the total opposite. I have to know every single thing you've ever done.
Best advice for ER rotations, overnight shifts: go home when they tell you you can go home.
Yes. Otherwise, you'll never go home.
Yes. It's not a test. They're
just
telling you to go home. Go home. So we've had then like these smaller rotations, or I don't know if they were, I guess, based on the program. Like for us, OB, psych were both quicker rotations. Our pediatrics one was actually a full 6 weeks, but those were like kind of subspecialized rotations, not as generic, but yeah. Any fun stories from those?
Peds.
Yeah.
I loved my peds rotation.
Really?
Yeah. The doctor was awesome. He was really chill. He had like been practicing for years. Like, we had a child come in one day and they had hit their head on something at the playground at school, and they had a lac like on their forehead. And I was like, I think it's a little deep to like just use glue. Like, I really think we should suture it. And he was like, I haven't sutured anything in 20 years. Like, we're not suturing it. And I was like, okay, like, whatever. And he went in and he was like, okay, like, you were right. Like, I really think we should suture it.
Yeah.
And I was like, oh, like, okay, cool. And he was like, well, do you want to do it? And I was like, yeah, kind of. And he was like, can you do it? And I was like, well, I've closed like on my surgery rotation where they were asleep. Like, it can't really be all that different. And
Except they're awake and screaming.
yeah,
and they're a child.
They were
Yeah.
a child. And so they're like trying to find all the stuff to do it because I guess like no one had actually sutured in
Right.
that office in a long time.
Yeah.
The needle drivers that they gave me were broken.
Yeah,
Amazing.
that makes sense.
That helps.
Yeah.
Yeah.
So I have this like 9-year-old on the table. They put like the little drape over his head. Then that's when he starts freaking out.
course.
Oh gosh.
And I'm like numbing him. He's fine. I get him talking about Fortnite and he's like all good. And then I'm trying to suture this up and I hear the office manager behind me just keep asking my preceptor, are you sure you don't want to send him to plastics? Are you sure you don't want to send him to plastics?
God,
so
like in the
stressful.
room, and like the
And I'm
parents
like-
are probably in there too.
Yeah.
Yeah.
And so I'm just like, okay. And I'm like, these got to be the best sutures I've ever done in my entire life. And they were. They came out
Yes.
amazing.
Slam
Like
rush it.
my preceptor texted me that night and he was like, you really showed up today. Like, good job. And I was like, this and my ER rotation, I am never going to feel better in my
Yes.
entire
Oh my
life.
God.
This was before my ER rotation. But
Yeah, those moments, they will they put you on cloud nine.
Yeah.
Then you
That-
get kicked back down when you use the wrong color suture. But
yeah. Or like when a baby comes in and I'm like, I don't know how to hold you. Like, what do I do?
yeah.
Yeah.
I liked the well child visits when they were like 10 plus.
Perfectly fine. And they're healthy too.
Yeah.
Yeah.
But like 7 and down, I don't know what to do with you.
Yeah.
Looking in ears of screaming kids, like forever,
Yeah.
not a fun thing for me.
Yeah, I did peds. Peds was 4 weeks, and mine was in like a private practice. And the physician, it was a MD, and she was like going through a divorce, so she was 100% not mentally
Checked out,
there.
yeah.
It was like a lot. So I would do all the well visits,
Yep.
the sick visits. Like I remember looking in everyone's ears, and I don't think can like everyone's ears red.
Yeah.
You
Yeah.
know?
Always
like
red
I would always say they have an ear infection.
Yeah.
Like if their ear hurts and it's red, like how do you
Like,
know the
Yeah.
difference?
yeah.
Seriously.
Yeah. So the doc that I did not like my peds rotation. It was honestly terrible.
Yeah.
This doc was like he lived on another planet than the rest of us.
Mm.
Everything you said was going to be wrong for some reason. So like if I went in and looked in an ear and I was like, oh yeah, it's an ear infection, and he's like, okay, what pathogen though? Like what type of ear infection? I'm like, I don't know. Like it just looks like
It's red.
No.
So it's infected. Yeah.
and then he would ask you the dosing for the antibiotics, weight based, in the room in front of the parents, and you know.
You have to make that.
I'm like doing
Yeah.
MIGs to KIGs in the room. Like my brain doesn't work that way.
Yeah.
The mom asking her like, oh, how much do they weigh? And the mom tells me, I'm like, how do I convert that to kilograms? And he's
Yeah.
giving me like 10 seconds and he's like, too slow. You're done. It was awful. And if by some magical chance I could convert it and like got the dosing, he would be like, I think it's a different pathogen, so not that antibiotic.
Oh
I'm
my
like,
god.
oh my god!
That's
Like,
so annoying.
and then he would make you stay there like until 6 o'clock at night when he was done charting, but he didn't let you do any of the charting, so you would just sit in his office on the
Just watch
sofa
him.
and watch him
That's annoying.
and stare at him.
That's really
Yeah,
weird.
it
Yeah.
was so odd.
I do recall again doing that conversion from pounds to kilograms and then
Yeah.
teaspoons to milliliters and then actually figuring out, but it took a really long time.
And then like what they come into,
Yeah.
because like the bottle amount, like, well,
Yeah.
yeah.
but yeah, that
Awful.
conversion and then the vaccine schedule.
Yeah.
That was also something I think very, very useful for test taking. Not that
Yeah.
you can't read about it, but I think, when you see them and they come in, it got to the
Yeah.
point where it was kind of routine. But then
Yeah.
if someone got off their schedule, like, oh my God, is this okay?
What do I do
to,
now?
like-
Yeah.
yeah.
Oh my
I
god,
think-
this is not what I read.
Yeah. And then everything was viral. Everything was like a fever, a cough.
A rash.
A rash. I was going to
rash.
say, you see all of the rashes.
Yeah.
Yeah.
But I think like being a pediatric physician, PA, whatever, like I would be nervous all the time.
Yeah.
Yeah.
What is the difference between this being just like a viral syndrome and this being like, I don't know, something that has to
Like
be admitted to the
Kawasaki.
hospital?
Yeah.
Yes, exactly. I was thinking Kawasaki. Yeah.
Memorize a lot for peds, I guess.
Yeah.
The dosing, the
Yeah.
vaccine schedule, what the rashes look like.
Yeah.
all
For
the
me,
things.
that was the easiest
Yeah.
EOR.
Yeah.
Yeah.
Yeah. If you know like your rashes and the vaccine schedule.
Yeah.
That's
then you're
pretty much
done.
all you need
But
to
that's
know.
what you do all day. And
Yeah.
then there's the random sick visit, which is either I say 50% antibiotic, 50% not.
Yeah.
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 Then we had a quick mix of psych and OB together, which is an odd combination, or is it? I don't know.
I didn't do psych. I just did 4 weeks of OBGYN.
Yeah.
So
yeah, my OB rotation was I lived at the hospital.
Yeah.
I would like to pretend it
Lived
never
there.
happened.
But I never did a pap smear.
What?
OB. I did them all on my family med.
Oh my
I did
gosh.
them in the ER, believe it or not. Wait,
Yeah.
not pap smear. Yeah.
Yeah, pap
Yeah.
smears.
Yeah. Pelvic exams were, I did ER first, and OB was like maybe 4th or 5th rotation. But I remember, oh my God, it was a lot of those, OB visits where they come in and you ultrasound, whatever. But a lot of just GYN stuff.
Yeah.
Yeah.
And like
Not a huge fan of it.
postmenopausal bleeding,
Yes. Yeah.
talking about different kinds of birth control. And then it's like you're on call 24/7 because you don't know when someone's going to have a baby.
My GYN was stuck at the hospital on my first day. So like they knew that I was coming in. I already had my ER rotation.
Yeah.
So I remember getting there and the medical assistant was like, so you've done this before, right? And I was like, I mean, like a handful of times a couple months ago as a student. And she was like, all right, well, there's 13 patients this morning that you need to see. Yeah.
So have at it.
Yeah. She was like, they're pap smears. So we'll call them with the results. And I was kind of like, oh my God, you will come in the room with me for every single one. She's like, oh yeah, no problem. And she did every single one.
Yeah.
I was like, oh, this is terrible.
Oh my God. They really threw you in there.
Yeah. Like for your actual boards.
Yeah.
The STD stuff, the OB staging, like the whole like labor.
Yeah.
I mean, I think that was important.
Placenta preva, they ask you about a lot.
Yeah.
Mhm.
Mhm. Which I didn't see. Like I didn't see that
Yeah,
like,
I
in
never
real
saw
life.
that.
Yeah.
For me, it just made me have like such higher respect for people that have kids,
Yeah.
because seeing both like a vaginal birth and a C-section birth, I don't like either option.
Yeah. No, it was terrifying. That was
And
like
I don't want either of that.
Our
Those
one
are
day,
the
one
only
out.
2 options. Okay, just so we're on the same page.
But like just seeing like a C-section, and it's just like it's a
Wild.
lot more involved than like you would think, and like the patient just has no idea what's going on.
Yeah.
And it's like they're happy to get their baby, and then it's purple, and it's like
It's it's under like, I mean, I've had a C-section because
Yeah.
I've seen C-sections. It is a massive invasive surgery.
yeah.
It's like aggressive too.
Yeah.
And it's not, well, mine wasn't planned. Like, it's not something I was like, I can't wait for my C-section. It was
Yeah.
something like, you're having this done today. And I'm like, what?
Yeah.
Oh, it's terrible.
Yeah, but midwife going elbow deep on the top of someone's abdomen to
Yeah.
pop that baby out.
Yeah.
I'm like, oh,
Yeah.
you're literally popping the baby
Yeah.
out.
Yeah. Yeah. Oh man. That was like our one day one
Yeah.
of my OB rotation.
Yes.
They were like, walk into the C-section. I was like, holy shit.
Yeah,
What
that's
is happening right now?
Again, put it on the list of things that just don't translate from like the didactic here to actually being there. I feel like you talk about it in a very mechanical way, and then you see these things happen. You're like, okay,
Yep.
yeah. Also, very surprised that for like, let's say, vaginal birth, the nurse
Mhm.
does everything,
Oh,
and the
yeah.
doc walks in literally when it's like happening.
If they can get there.
If they can get there,
Yeah.
exactly.
Because-
But the nurse is like the hero, like
Yeah.
a labor
Yeah.
and delivery nurse. I get that.
Yeah.
Yeah.
You're doing all of it,
All of it.
basically.
Mhm.
Yeah.
One of the vaginal births that I saw, because I only saw 2, I was with one of the midwives because my preceptor, if he was off, I had to go with one of the midwives.
Mhm.
So I was still at the hospital because it was only a 3-week rotation.
Yeah.
I had to get everything
yeah,
all
in.
of your
yeah.
experience.
And which was fine. And I remember I was with the midwife. She went in, she like broke this girl's water because she was laboring for like ever. And then she was like, oh, it's going to be a minute. Like she put me in this random room by myself, and she was like, I'll come back and get you when we have to go back in. And then like 5 minutes later, she comes in, she opens the door. She's like, well, she had the baby.
Yeah.
And I missed it.
Yeah.
And I go in, and the nurse is like on her knees on the floor, baby in her arms.
Yeah.
The girl like stood up, and the baby just came out, and the nurse was like, help!
Yeah. Yeah. I mean, I have so much respect for labor and delivery
And
nurses.
she
yeah.
stild had the mindset to look at the clock and be like, time of birth was 8:59.
Because
my
guess
gosh,
what? That's
see?
not the first time that's
Time was
happened for
yeah.
her.
Yeah.
Wild. Oh, man.
Yeah. That's crazy. And
yeah.
then, I didn't do psych, but I would consider, I mean, that I would think that's important because
Yeah.
as
Yeah.
the first doc that I work for tells me, a lot of our patients are psych patients.
Yeah.
Yeah, they are.
Whatever
I mean,
field you go in.
Yeah.
Yeah.
I do a lot of mental health in
I was going to
My
say,
job
yeah,
right
yeah.
now.
I believe that.
Primary
Mhm.
care is a lot of
everyone's
that.
anxious
Knowing the meds for that
Yeah.
is
and like how to
Key.
taper on and off.
yeah.
A lot of my psych, it was outpatient, but they also did a lot of telehealth.
Mhm.
So it was kind of like a little mix of both.
Yeah.
I did feel like I saw like a pretty good spectrum of like what you're supposed to know in psych.
Right.
Like I
Yeah.
saw a little schizophrenia, saw some bipolar, saw a lot of anxiety and depression.
Yeah.
Yeah.
But I liked it. It was overall, it was
Yeah.
a good experience. I had like another student who was in my class with me. So it was like me, her, and the preceptor just like holed up in his office, and then we would just like take turns.
Yeah. Did you get to elective wise? Did you get to pick yours, or was it like you could pick out of anything that your heart desired, or were they like, hey, here's like the 4 electives you can pick?
So we got to pick, but we had to give them like a top 3.
Okay.
And then it was whoever, if they could find like a match for you.
Yeah.
So for me, I think I did ortho, derm, and I think I did ID. Because I actually kind of like infectious disease, like all the rashes and stuff. I think that's really cool. And for me, I did all of my like experience before PA school in dermatology. So I was like, I don't necessarily know if I want to do a rotation in that.
Yeah.
Because like I already have the connections. And, I don't really have any ortho ones, and I was also interested in ortho. So I was really happy when my ortho one worked out.
Yeah. Us too.
Yeah, it worked out for the best.
Yeah,
That's right.
it did.
So-
I loved my ortho rotation. It was a good one to like end on too.
Yeah.
Yeah.
We like getting PAs that have already done surgery. So you have like some idea of, it's a combination of clinic and it's OR and it's procedural. So when we get ortho elective PA students first, it's kind of really hard because they can't do anything.
Yeah.
It's not that they can, it's just they haven't, I guess.
Yeah.
Hannah, did you have like the same experience you got to pick?
I kind of. So I got to pick, they originally told me you can have, because the only difference, we went to the same school, but my program was 27 months, and then they had changed it to 24 when you went through. So we had 2 elective rotations. They told me I could do one in ortho since I already had ortho background, and they were like, you should pick something
You should do
out of
that.
your comfort zone. I was like, I don't want to though. But so originally I had picked, actually per one of our surgeon here's recommendations, he was like, you should do a plastics rotation. And that would be
loved a
really
plastics
helpful.
rotation.
So that was what I chose, was ortho and plastics, or ortho surgery and plastics. But COVID, elective surgeries got canceled. So my first rotation here, I couldn't do any time in the OR. So I did 4 weeks of like non-op ortho stuff in COVID times, which felt like nothing. And then I came back for my last rotation and did more. So they like flipped the script. They were like, well, we can't find you a plastics one. COVID ruined everything. So if you just want to go back
again,
you can go back.
Yeah.
And so I did. Yeah. Did you do ortho?
I did ortho and I did ER. So I did ER with a PA that worked in the ER, but his main job was in ortho. So he was like an ortho guy working in the ER. Of course, I was like, that is me. That's what I will do.
Yeah.
I will work in an ortho job, and then I'll get like a couple shifts in the ER, and then this is enough. So,
Yeah.
But it was great. I loved it.
An important thing to mention is all 3 of us found our jobs, our first jobs at least, from our rotations. So that's a big thing.
Let's go into like do's and don'ts. So again, Jordan and Hannah, you were both my students at one point. So I think being there, being on time, and being engaged, huge. So I've had PA students that, like, when I get a PA student that'll tell me like, oh, hey, I want to go into cardiology. I'm just doing this to do it. I'm such a turn off. Like, I mean, tell me that so I know where your head's at, but also tell me what you're hoping to gain from this, because I will invest in you as much as you're investing in me.
Right.
Yeah.
So I think like being there, being engaged, like, hey, you want to try this? The answer is always yes.
Yeah.
Even if you don't want to try it, the answer is yes. You're going to try it.
Yeah. And being teachable. So I think, coming in, you think you know how to do an injection. Okay. But here, do it this way so the patient experiences it better. Like, just being open to like tweaking what you do, because that's invaluable. Like, if you get professional, tips on what to do to tweak what you're doing, it's just super helpful.
Seeing patterns and like learning how to be helpful. I think that was a big struggle for me, like coming from like working here as a medical assistant and athletic trainer. Coming and doing my rotation here, I'm automatically in the mindset of like, I'm rooming the patients and I'm getting a history and I'm doing my role, and like switching that to now doing other things and finding different ways to be helpful. So just try to do it all.
Yeah. And I don't think, like you said, I think changing your brain for what that rotation requires of you is huge. Like, you can't come into, for example, orthopedics with your family medicine brain, So I think just being malleable is also huge, whether that's PA school or your first job. I mean, that is invaluable advice.
Learn to have short presentations.
Yes. Less is more.
Less is more. Yeah. I'll zone out very, very quickly if somebody starts telling me like, ooh, they went to their cousin's barbecue and blah, blah, blah. I'm like,
no.
Yeah. Like, what is it and what are we going to do?
Yeah. And then charting. So again, when I did PA school, it was all written. It was like soap notes. It was super quick. So doing that and getting someone to sign off on it right now, when I have a student, like I still have to do my day. So I will ask, and the last student we had, I'm like, hey, do you want to document? And they were like, well, no, I'd rather do. And I'm like,
that is
need you to.
I get it. I also would rather do and not document. But that is one of the hardest things that I think PA students have afterwards is like how to document.
Yeah.
Because if you do all the things at the end of the day, those charts do not go away. So learning how to do that and again, getting comfortable with the uncomfortable.
Yeah.
So Jordan, what can you tell us for like how to survive? Like give us like this is how I didn't die.
Ooh, that's a good question.
So what did you do? Did you have a good like sleep schedule?
No.
Okay.
Probably not. It could have been better. It definitely wasn't the worst. Like I had some classmates who just were not sleeping at all.
Yeah.
I think for me, it really helped that I lived with my partner and they were still on their regular schedule.
Yeah.
And they kind of took over a lot of the like house stuff.
Yeah.
Which I was very thankful for. And that kind of kept me on a schedule. So I guess it would be like not being afraid to like lean on your people. Like if you need to call your mom and debrief, even if she doesn't get it, like call your mom.
Yeah.
And still like try to have a life outside of it.
Yeah.
It's a little bit easier than the didactic because your weekends are usually a little bit more free. But mine was also just, I had like 6 weddings last year. Like there was a lot of stuff going on outside of my life that like I didn't let school stop me from doing.
Yeah. But life still happens. Like even though school is like all encompassing and you're telling yourself like this is how I'm shaping how I'm going to be as a professional, you still have like holidays still happen, weddings still happen. Did you set parameters with friends or did you lose some friends?
I definitely lost some friends or just like lost contact with them because I just was really bad at answering my text messages or like I just didn't have time. But I think just like knowing like, hey, like I have all my rotations, like this is my schedule. I'm going to be late to this. But like, I promise I'll be there for like this thing. And then like,
probably also late for that thing. But
yeah. I like missed my best friend's rehearsal dinner because I was on my OB rotation and like could not leave early.
But again, like it gives you perspective in life because life goes on.
Those things happen.
Things happen. What about comparing yourself to others?
That's something that I feel like is just always going to happen.
Mm-hmm.
I was pretty lucky where I only had like 2 rotations where there was like a direct other student with me. And I mean, you're always going to be thinking like, I don't know what I'm doing. I feel like I could do that better, blah, blah, blah. But I mean, you're a student. Like this is the time for you to learn. If you're going to make a mistake, it should be now.
Yeah.
When you have someone there that knows like how to navigate it and how to fix it.
Yeah.
Yeah. I don't know. Like for me, it was very much just like a little bit of imposter syndrome. Like I didn't know what I was doing, but I don't really think I compared myself to other people because it was like, this is me. This is what I can do.
Yeah. And don't be embarrassed to like speak out and like say the things that you're thinking too, because I think that debilitates some people. Like you're so afraid of being wrong. You don't want to say anything. And the number of times in my life, this still happens to me where I like know what to say and I know the answer. But a part of me is like, maybe it's wrong and I'll sound stupid by saying it. And then somebody else says it and I'm like, wait.
Yeah, I knew that. But even like with confidence, so the fact that you come in and you have no confidence, let's say it's week 1 of family medicine rotation versus week 6, like how can you advise people to handle like when you don't know and you're getting the constant criticism, like how do you handle that by developing a tough skin and continuing to go versus crying every night when you get home?
Yeah. I think you just have to like not be afraid to ask questions. Ask your preceptor like what you can be doing better. Is there anything in particular that like I can look into that you think would benefit me going forward? Or like if you're getting stuck on blood pressure meds, like go home and review that.
Yeah.
Don't be afraid to ask questions during the day. Like if you see a patient, you're like, oh, I think it might be this, but what are your thoughts? Like they've been doing it longer. They know more than you do.
Yeah.
And just asking for like personal feedback too was always a big one. Like I've always tried to ask my preceptors, like, what can I be doing better?
Yeah.
Like, that was important for me. I also just feel like I generally like talked a lot on all of my rotations. So like I just kind of like got to know a lot of people, and just like it was very obvious like what I was thinking and like what I wanted to do.
Yeah.
Probably a little too much.
I don't think so, because I think it's worse when somebody's like super quiet. And
yeah, well, it's super quiet to me says that you're not interested or you're terrified, which I don't know what's worse, right?
Yeah.
But I think being interactive, I don't know if overly talkative is the right way to say it, but being interactive, I think, is really important, because it also like gives your preceptor an idea of how to interact with you. You know what I mean?
Yeah.
So good. And both of you here got jobs based on your clinical rotation. So always be thinking that like each of these clinical rotations is an interview.
Yeah.
You know, so whether you go into it with your idea that you want to do or not, it may end up in something awesome. So I think that is something you have to go into those rotations thinking.
Yeah.
So,
do the extra things. My doc was taking call when you set up the rotation. So like every time we had a call thing late at night.
That's right.
I was like, I'm going to be there.
Right.
And even if like you're not trying to get a job necessarily out of it, like it's just all networking.
Yeah.
Like you need physician letters to get your license.
Yeah.
You need letters of recommendation for things.
It's a small world too.
Yes.
And like
it is.
especially like if you're trying to work in the area where you're doing your rotations, like everyone knows everybody.
Yeah.
Yeah.
And again, maybe you do like an ortho rotation and you're like, oh, I really like ortho, but I don't want to lose like all the family medicine stuff first.
Mm-hmm.
So you go do family medicine, and then in 2 years you're like, oh, I want to do ortho. Well, hopefully you have a good relationship with your preceptor, and you can like reach out to them and be like, hey.
Yeah. Hadn't done my clinical rotations in a long time, but I think they were very impactful. I think even the things that I learned there, part of, even though I hated OB and peds, I think part of that I, have pulled into, either personal life or professional life. So it's a very impactful time. So just put yourself out there, do it, be good at it, ask questions. Don't use black sutures.
Don't
on
use
bearded
black
men.
sutures. Yep. That is takeaway number 1. Well, Jordan, thanks for coming on and hanging out with us today.
That was great.
Updates. We have some fun episodes planned coming up, and I think we decided a couple weeks ago we're going to start doing some video recording. So
we are. We're going to make a switch and start doing some video recordings with some more depth to what we're doing. So I'm very excited about that.
Yeah, absolutely.
Cool. Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.